Stop! Whitening your teeth the wrong way can permanently damage them. Hi everyone, I'm Dr. F, and welcome to Teeth to Smile. If you find this content valuable, please subscribe and hit the like button. Your support helps us bring you more science-backed dental content. Are you actually a whitening candidate? Everyone wants whiter teeth, but the first question isn't how to whiten, it's should you? Not everyone is a good candidate for teeth whitening. In certain situations, whitening is simply not recommended, especially during pregnancy or nursing, for minors, during chemo or radiation, or when specific medications or medical conditions are involved. There are also cases where whitening might be safe but not effective. If you have fillings or veneers on your front teeth, or deep internal stains like tetracycline staining or fluorosis, the results can be unpredictable. That's why step 1 is always the same. Talk to your dentist or dental hygienist before whitening. And don't skip this, whitening works best on clean teeth. If you're up to date with professional cleanings, great. If not, that should come first. Time versus money, the real trade-off. Once you know you're a candidate, the next decision is about time and budget. Here's the reality. Faster whitening usually costs more. More affordable options still work, they just take longer. No matter which method you choose, the final result can be very similar. The difference is how fast you get there, how much you spend, and how sensitive your teeth are. All whitening products work because of peroxide. The higher the concentration, the quicker the results tend to be, and usually the higher the price. Whitening strips. Whitening strips are often the starting point for many people. They're affordable, easy to find, and effective if you're patient. Because they contain lower levels of peroxide, the whitening process is slower, but results can still look very professional. They also give you flexibility. You can adjust your schedule, take breaks, and slow things down if your teeth start to feel sensitive. The downside is that strips don't always stay perfectly in place. In some people, they can slide and irritate the gums, especially if there's a lot of saliva. Custom whitening trays. Custom trays are made specifically for your teeth at a dental office. They fit like clear aligners and, if taken care of properly, can last for years. When you want to whiten, you simply purchase the whitening gel recommended by your dental provider. They require a higher upfront cost and aren't as convenient as store-bought products, but they tend to be much more comfortable. Because they fit so precisely, the whitening gel is less likely to touch your gums, which usually means less sensitivity and more controlled results. In-office whitening. If speed is your priority, in-office whitening is the fastest option. In many cases, you can achieve visible results in a single appointment. The trade-off is that this option is typically the most expensive and the most likely to cause temporary sensitivity. The products used in office are much stronger and may be combined with heat or light to accelerate the whitening process. If you already have sensitive teeth, this is something to carefully consider. What actually matters? Here's the most important takeaway. All of these options can work. The best choice depends on your lifestyle, your budget, and how sensitive your teeth are. And one final warning, if you ever lose the instructions for a whitening product, don't guess and don't use directions from another box. Different products use different types and concentrations of peroxide, and the timing is not interchangeable. Always follow the instructions that come with your product. If you found this helpful, make sure to like and subscribe for more science-based dental content. And remember, a healthy smile always comes before a white one.